The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening and welcome to You and Your Doctor, sponsored by All County Healthcare. I am Dawn Graubert, your host. All County Healthcare is a Medicare certified home health agency working in Dade, Broward, and Palm Beach County. For more information, you can contact them at info@allcountyhealthcare.com or 954-717-7027. Tonight, I'm excited to introduce you to Dr. Alfredo Hernandez. He is a highly respected, board-certified gastroenterologist and internal medicine health physician with more than 20 years of clinical experience. He currently serves as Chief of Internal Medicine at Mercy Hospital and Division Chief of Gastroenterology at FIU Herbert Wertheim College of Medicine, where he plays a vital role in advancing digestive health education, patient care, and physician training. Dr. Hernandez earned his medical degree from the University of Miami and has built a distinguished career specializing in the prevention, diagnosis, and treatment of complex gastrointestinal conditions. His clinical expertise includes colonoscopy, upper GI endoscopy, colon cancer screening, inflammatory bowel disease, liver disease, pancreatic disorders, swallowing conditions, among many others. He also serves as Chief of Gastroenterology at Mercy Hospital and is a past member of Gastro Health Board of Directors. Dr. Hernandez is deeply committed to providing good patient outcomes through early detection, advanced endoscopic procedures, and compassionate, education-driven care. You can locate his office through Gastro Health at 3661 South Miami Avenue, Suite 907, 33133, or here is his phone number, 305-856-7333. All right, without further ado, here is Dr. Hernandez. Welcome.
Thank you, Don. How are you doing today?
How you like that bio?
That was great. Thank you very much for the introduction.
Thank you so much for joining us. I appreciate your time. And of course, go Canes, go University of Miami. I wanted to echo, exactly, all about the U. Wanted to ask you, before we get into gastroenterology, what about gastroenterology and internal medicine really got you into the field as a whole?
I love the complexity of medicine in general. And within internal medicine, there's only two areas that have a lot of procedural aspects, which is cardiology and gastroenterology. And I felt gastroenterology had more things to offer me as I enjoy procedures. There's more variation in upper endoscopy, colonoscopy, endoscopic retrograde cholangiopancreatography, endoscopic ultrasound. So we have more procedures that we do, and I sort of gravitated toward gastroenterology and gastro health instead of cardiology.
And the procedures that you do, have you seen a big change throughout your career?
Interesting enough, yes. There is increased definition and improved, how would I say this, visualization of polyps and visualization in ultrasound. There's just improvement. And now the new thing will be AI and detection of polyps using artificial intelligence, which that'll be coming up in the next couple of years.
And you see on TV, everybody does, that there are these tests you can do at home that detect for colon cancer. What do you think? Really going in and looking like you do versus a test? Are there any indications for one over another?
I think they're all great screening procedures because at the end of the day, we want people screened. We want people to check themselves. We want to prevent colon cancer. That is the key to this. I feel that colonoscopy is better in the what it does, in that I can actually prevent the cancer from occurring. Because if I find a polyp or a small growth in your colon and I remove it, it never has a chance to become a cancer. While these other tests are good at detecting cancer now and preventing death, they're not as good at preventing cancer itself. So that's why I'm a strong proponent of colonoscopy, but I'm a strong proponent of all the tests that prevent cancer and identify colorectal cancer, because they all can benefit and increase life expectancy.
Now, March is colon rectal cancer awareness month, colon cancer awareness month. Great time to be having this conversation, because I think there's still a lot of fear in the unknown of, I need to get an endoscopy, and it may not even that they're concerned that something might go awry or wrong in the procedure. It's more of, maybe they're going to find something.
Yeah, but I agree with you completely. My patients have that fear, and I try to explain to them, if we catch cancer, even if, or pretend I catch a polyp early, I prevent cancer from ever occurring. Even if I catch a cancer at an early stage, like a stage 1 colon cancer, your risk of being alive is more than 90%. But if you wait, and that stage cancer that I find is stage 4, your life expectancy is greatly diminished. So it's all about prevention and early detection when we're talking about colorectal cancer. And the numbers are there, very clear. Stage 1 colon cancer, you're doing well. Stage 2, you're doing well. Stage 3 and 4, the outcomes are not as good.
And what are the studies, the literature saying about when to start screening and then how often to return?
So that's another interesting topic. It used to be 50 was the magical age.
Right.
But recently, over the last couple of years, it's 45. And that's with very good evidence that we're noticing an increase in colorectal cancer at earlier ages in this country. So we have brought down that number to 45. And 45 is for general, men and women, because the misconception is that women don't need to do this sometimes. And it's only about men. And I'm like, no, it's the same risk in men and in women.
I was going to ask, I've never even heard that. You would think nothing would be any different. It's not like OBGYN or, right? Your internal system is your internal system.
And we all eat the same foods, because we usually eat the same food when we're sitting together at dinner.
So 45, how often after that? Is it based on family genetics? Is it based on what you find?
So 45 is average risk. That means no family genetics. If you have family genetics, it's very different. But let's talk about a normal average risk individual. It's 45. And if I don't find anything, or the gastroenterologist does not find anything, it's every 10 years. If there is a polyp, depending on its size and how many polyps, then it might be 3, 5 years, or even 7 years.
And
so it all depends on what is identified.
Okay. And the procedure itself, pretty typically outpatient.
Always outpatient. Never, we do inpatient, but for other reasons. But when we're talking about screening, it's always outpatient. It's usually an hour or 2 in the facility. The procedure itself takes 15 to 25 minutes, depending on what we find and how many things we need to do when we're in there.
Pretty easy, pretty simple. All right, so there's so many things to touch base on. Foods. Are there certain foods, fiber, hydration, that we should be looking at more for better gut health and better colon health overall?
Yes, of course. Fiber supplementation, hydration are keys to good gut health and good microbiomes. Soluble fibers, we always say oat bran, certain fruits that we have, vegetables are very important in our probiotics, in the polyphenols that they give us, the enzymes. So vegetables, fruits, oats, things that are bad or we feel that are bad are smoking for colon cancer awareness and colon cancer risk. Obesity, also not good for colon cancer. Those are the things. Like smoked foods, meats, processed meats, not good, we feel, for colon cancer.
Now, why is that? I know everyone's into good health and good gut health. Why are smoked foods and obesity, how is that linked to colon cancer?
Obesity is linked to almost all cancers. Those links are very complex, very difficult to define, but there's definitely an association with obesity and colon cancer and colon polyps.
And for some symptoms people should look at that they really would have to get you, other than like gross blood in the stool, are there any other upset stomach issues that you say, listen, I really got to call Dr. Hernandez in Gastro Health?
So one of the things that I really speak to my patients about is changes in bowel habits. If your bowel habits are usually this way and all of a sudden they start changing and something is different, like if you went to the bathroom every day and then you stopped going to the bathroom, that's an issue. If you went every 3 days and now you're going every day and it's soft and watery, that's a problem. So changes in bowel habits, I think, is something subtle that not everyone realizes is a problem. Of course, like you said, blood. Another big one is weight loss. Unexplained weight loss, I find, is a very big issue and something we need to define and work up.
And that would be for your lower GI. Upper endoscopies, what are some symptoms we're looking at for that?
So that is epigastric pain, nausea, vomiting, decreased appetite is another big thing that I worry about. When someone tells me I used to eat everything and now I just don't want to eat, that's an issue.
A lot of reasons to call you, Dr. Hernandez. All right, we're going to take a quick commercial break. I can't believe we're already like halfway through. When we come back, more questions, so many topics, gut health, gut-brain barrier, so many things. More to come with Dr. Alfredo Hernandez, and we will be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare, a Medicare-certified home health agency in Dade, Broward, and Palm Beach County. For more information, contact them directly at 954-717-7027 or info@allcountyhealthcare.com. Tonight we're talking to internal medicine gastroenterologist Dr. Alfredo Hernandez. So let's bring him back on. All right.
Hello, Don.
We're going to continue our conversation. Over-the-counter meds, safe to take? I don't even want to name them, but, there's the pink stuff, and there's the pills for antacid, then there's the chewable, chalky things that we all know what they are without naming brands. What do you think?
Right. So they're all generally safe to take. The thing is, how long are you taking them for? So, like you said, the chalky stuff, the other stuff that brings down our acid, those are fine in short term. But if you continue taking them and you still have your symptoms 2 weeks later, that's an issue. Then you need to speak to someone and see what your symptoms are occurring and what's going on. So they're all good for short-term issues. But if the problem persists, I think you need to speak to a professional. And many of these medicines used to be prescription strength, and they were just released over the counter over the last 15 to 20 years. So we use these medicines, so that's why I'm saying that.
I was going to ask about that because you're right. A lot of them, they've reduced the strength on some of them, and they reduce the amount that you take. So now people self-medicate and they Dr. Google. Probably not a great idea for long-term care.
Exactly. Like short-term, I think it's not an issue within a week, 10 days. But if you're past the 2-week mark and you're still having your symptoms, you probably should talk to at least your internal medicine doctor, your primary care doctor about it.
And how much does stress play a role in gastrointestinal upset?
Oh, a lot, I think. It's not proven, but you see it in your patients day in and day out. When they're in stressful events, their irritable bowel syndrome gets worse, their inflammatory bowel disease gets worse, some of their nausea gets worse. But the science behind that is inconclusive. We're not sure, but we just see it on a daily basis.
All right, so when a patient comes to you with all these symptoms, first thing you're going to what? Go through their diet, go through their stress, try to mitigate that before you go, let's do an upper GI.
Definitely. Before I do a procedure, we have a lot of things we need to check prior to that. And it's mostly sitting down and speaking to the patient about their diet, their lifestyle, are they exercising, what's going on in their life. That's the important part. And then we usually try to do testing that doesn't include endoscopy. We do stool tests to look for infections. We do blood work just in case, other parts of the body, other metabolic issues affect how our GI tract works. And then if all this is negative, then we move on to upper endoscopy or colonoscopy and stuff like this.
Do you find certain things can be helped, not cured, but helped by changing diet, exercise, what you're eating, you're internally taking in?
I would say, yeah, over 50% of the things that I see can be helped by diet, exercise. Especially diet. For the GI tract, for gastroenterologists, it's a lot what we eat. We do it to ourselves many times. It's our lives, our stressors, how quickly we eat, how much we eat, what we're eating.
And I think as we
timing
age,
of meals.
Right. And I think as we age, what we used to eat when we were in our 20s, 30s, you're still young, but you reach my age and older, and we're looking at things we used to be able to tolerate, the fatty foods. Now we're looking at what? Gallbladder, fatty liver disease.
Yes. Yeah, those are like, I used to be able to eat a pizza at 11 o'clock at night at 18 years of age. I eat a pizza now at 6 in the afternoon, I'm having reflux, That's just different. Our bodies are different. We age. So it's very important to realize how old we are and what we're doing and what we're eating as we get older.
I'm down to like scrambled eggs and soup these days. I know. Fatty liver disease, gallbladder disease. What are some symptoms that we look at?
So fatty liver disease, I think this is going to be the big one that we're going to be attacking in the next in the next decade, let's say in the United States. And it's very common. It's occurring in a large portion of our population. It's asymptomatic. You usually don't have any symptoms until you have cirrhosis, until you show up with real liver disease and liver failure. So we're finding it incidentally on ultrasound or on CT scan or on imaging is usually how we find it, or their liver enzymes are a little elevated. And then we do a workup and evaluation. The good thing is that there is treatment now for fatty liver, which are these newer drugs that a large portion of our population is on. These GLP-1s have actually been approved for the treatment of fatty liver disease.
That's interesting. So you may not even be obese or have diabetes that you would say typically qualify for a GLP-1, but present with fatty liver disease, and now we're looking at that as a treatment?
Certain aspects of fatty liver disease, yes. That is one of the treatments now.
And
that's relatively new over the last year.
Not necessarily like cirrhosis by alcohol. There's NASH, right? There's non-alcoholic cirrhosis, fatty liver disease.
Yeah, the majority of cirrhosis in this country now is likely due to fatty liver disease, not alcohol, not hepatitis C, not hepatitis B. We can cure hepatitis C with taking a pill for 8 weeks. We can treat hepatitis B with a pill every day. So those two are pretty under control. Alcoholism is more difficult, more challenging. But we have an issue of obesity in this country, and that's really what we're seeing now. Many of the cirrhotics are due to fatty liver disease.
And there's no symptoms.
No, until it's too late.
All right, so if somebody comes
yeah.
to you without, it's so crazy, right? Come to you without symptoms, you may diagnose this just based on an ultrasound, like what would you do, an abdominal ultrasound and see what we're looking at?
Usually it's found or they're referred by having an imaging study for something else, and it finds the fatty liver in the ultrasound or the CT scan, or they have elevated liver enzymes, and they're sent by the primary care physician due to the elevated liver enzymes that are not improving.
Interesting. And how are the GLP-1s helping this?
We think by reduction of meals and losing weight.
So we can reverse the
That's how
fatty
we
liver
think.
disease.
We can improve it, yeah.
And I guess a lot of it comes down to diet, what we're looking at, what we're putting
What
in.
we're eating. And activity, and physical activity and sedentary lifestyle, like you said. More than 50% of what we treat can be treated by food and diet and exercise.
That's incredible. And what do you see on the horizon for gastroenterology? Where do you see it going as a field?
I think it's going to continue, especially in fatty liver. I think colon cancer screening is going to continue and be more pervasive. We're going to have better testing. We're going to have better equipment, more imaging. We're going to have AI that's going to help us in identifying polyps and seeing which ones are going to be bad, which ones are not. I think the field continues to expand. And I think as a society, we need to try to continue improving our nutrition and our physical and lifestyle changes, which is, I think, very important.
Have you seen medicine change from your training in med school to where you are now as far as looking at lifestyle, diet, exercise versus when you went, right, you're in med school and you're doing your rotations? Were they even teaching that?
I would say much less.
Right?
These guys now that are in medical school, we actually have a lot more nutrition, a lot more lifestyle compared to what I had in the late 1990s.
It's reducing
And
stress,
even
eating better. Yeah.
Yeah, no, and exercise, the importance of exercise. It's the studies are out there, and they're showing improving how beneficial it is.
It's changed so much. And as we approach colorectal cancer awareness month, what are some top points you want people to take away from this? We've got about 3 minutes left.
So I think the most important thing is to get screened. No matter how you do it, if it's colonoscopy, if it's a colon stool test, if it's a blood test, whatever test it is, get it done. It's important to find out early because early prevention saves lives. That's the most important thing that I would like everyone to understand. If you choose colonoscopy, it's a safe, relatively quick procedure that also saves lives. If you choose the other ones, it's fine, but do it. You need to be screened. Listen to your healthcare provider, listen to your friends and family that tell you it's very important.
And the first time you do it, you think, I don't really want to do it. I'm aging. I don't want to go through the procedure. I don't want to go through the prep. None of it's so bad. It's what our minds create of what could be that probably isn't. That if you do the screening, like you said, and you do it preventatively, then you're not worried about what's going to happen down the road if you don't do it.
And it's interesting. Now, since I've been in practice so long, I've been doing colonoscopies in individuals that I tell them, you don't need to do this anymore. You're of a certain age. And they still want it because they're like, no, I've done this for 20 years. I prevented polyps. I've always had polyps. I'm like, I know, but we're good now. So that's another aspect that's getting interesting.
Okay, so I have to ask you, at what age do you say you no longer need screening?
So there's different, how would I say this? Different societies within gastroenterology have different ages and different task forces. Some say 75, some say 80. So I'm more of the understanding and thinking it depends on the individual and how the individual is health-wise to determine those. Not about age, because some people that are 80 look like they're 60. Some people that are 60 look like they're 80. So
Right.
it depends on the individual more than anything in my training and what I think.
All right. Bottom line is get screened.
Yes, that is the bottom line.
All right. So, fun fact about you, Dr. Hernandez.
How would I say this? I love fishing. I think fishing is just like looking for colon polyps. So I'm always looking for these things. And when I find them, I get very happy because I think I caught a little fish.
All right. Great place to fish in Miami. You can't get better than that.
Yeah, exactly.
Oh, my God. Well, thank you so much for joining us. Again, you can find Dr. Alfredo Hernandez at Gastro Health at 3661 South Miami Avenue, Suite 907, Miami 33133. Or you can reach him at 305-856-7333. Dr. Hernandez, thank you so much for joining us.
Thank you very much, Don. It was a pleasure.
Have a wonderful evening. And for more information, to get in touch with All County Healthcare, your Medicare certified home health agency in the Tri-County area, give them a call at 954-717-7027 or email them at info@allcountyhealthcare.com. I'm Dawn Graubert. Happy Thursday, everyone. Have a great evening. March is colon cancer awareness month. Get screened, reach out to your doctor, and we will see you next week.